Hello all, this is Dr. Rup Kumar. Welcome back to another session of Masterclass series from Dentospedia. Today our topic is about maxillofacial trauma. We are going to deal with the dental trauma and facial skeleton trauma. And the first one, that is dental trauma. We have an important classification, that is Ellison-Davy classification. Here you can see different classes of fractures related to dental trauma. In class 1, there is only involvement of the enamel fracture. In class 2, there is involvement of both enamel and dentin, but without exposure of the pulp. In class 3, the fracture is involving enamel, dentin and pulp. Okay. In class 4, the tooth become non-vital because of their trauma. In class 5, tooth has been avulsed due to trauma. In class 6, we might see either crown fracture or root fracture. It is kind of a complicated one. Okay. In class 7, there is a tooth luxation injury without crown or root fracture. In class 8, there is a fracture of the crown at the cervical region. In class 9, it is related to the traumatic injuries of primary dentition. So this is Ellison-Davy classification. And coming to the jaw fractures, particularly in mandibular fractures. So mandibular fracture is nothing but a break in the lower jawbone and one of the most common facial fractures. So in the facial skeleton, nasal bones and mandibular bone, they are kind of a prominent, and that's why they are commonly affected in the trauma. So the nasal bone is the first commonly occurring fracture in the facial skeleton, and the mandible goes for the second place. Okay. And what are the reasons for trauma? Traffic accidents, falls, assaults, sports injuries and industrial accidents. And come to the anatomical considerations. The mandible has a certain weak points such as condyle, angle and symphysis regions, making these are the vulnerable points for fractures during accidents. Okay. And coming to the clinical features, so there are certain common clinical features for all mandibular fractures. They are pain, swelling, malocclusion, restricted mouth opening and mobility of the teeth. Okay. And coming to the diagnosis, how do you diagnose the mandibular fractures? So the most commonly investigation used is OPG, and we go for CT scan if possible, and IOBA and bite being they are kind of an unnecessary in these kind of situations. And coming to the classification of fractures, they are classified based on the location, based on the displacement and based on the complexity. Based on the location, we have symphysis fractures, body fractures, angular fractures, condylar and ramus fractures. And based on the displacement, they are divided into favorable and unfavorable fractures. Based on the complexity, it is simple, compound, comminuted. Okay. And coming to the complications, we have certain complications we seen in other bones. So similarly, these complications can occur in mandibular fractures such as infection, non-union, malunion, any nerve injury like inferior alveolar nerve injury due to the fracture. Okay. And also functional impairment can occur. So it's all dependent on the type of fracture, the type of impact. Okay. And coming to the management principles, we have mainly 3 important principles: reduction, fixation and immobilization. And you will learn about these 3 principles in detail in maxillofacial surgery. And coming to the prognosis, what can we expect? Okay. Usually the most mandibular fractures heal well, and in some cases, in few complicated cases, the healing can be late. Okay. And rehabilitation can be given or is needed for few cases. Okay. And this is a Dingman and Nedwick classification based on the location of the fractures. So it is classified into dento-alveolar fractures, symphysis fractures, parasymphysis fractures, angular, ramus, coronary fractures and condylar fractures. So this is about Dingman and Nedwick classification. And here you can see this is a horizontally favorable and unfavorable fracture classification. Here, the ramus of the mandible is, they have muscles attached, the muscles of mastication, right? Here there is a masseter on the lateral side. We have temporalis muscle on the coronal process, and on the anterior side and inferior side, we have certain genioglossus, geniohyoid muscles, and also digastric muscles are present. So these group of muscles, they try to elevate the fractured bone, and these muscles present in the anterior inferior region, they try to drag the bone in this direction. So based on the fracture line, right, if the fracture line is is in such a way that the bones are present intact without any movement, they are called favorable fractures. Here you can see the fracture line is present in a kind of situation where the bones of on either side, they are not in, they don't get displaced because of the fracture line design. Okay, but here you can see the fracture line is kind of an slant in nature, and because of this nature of the fracture line, the bony fragments are displaced. So muscle pull is already present. So if the fracture line is, favorable for displacement of the bony fragments, they are not easy to heal, right? And coming to the vertically unfavorable fractures, here you can see the medial and lateral pterygoid muscles are pulling the ramus of the mandible towards medial side. Okay, and if this is a vertically unfavorable fracture, this is a vertically favorable fracture. Okay, and this is a symphysis fracture. You can see in the OPG there is a clear fracture line, and this is a 3D CT scan. You can see the fracture line easily, and this is a parasymphysis fracture. Here you can see the angular fracture involving, third molar. Extracting the third molars in angular fractures is a kind of a controversial topic, because few say because of the presence of impacted third molars, it favors the angular fractures, and few say they don't agree with them. So it is a kind of a controversial topic. Here you can see the condylar fractures. This is a CT scan coronal view. Here you can see the fracture line, and this is a lateral skull view. Here you can see the skull fracture, the mandibular condylar fracture. And this fracture is called Gaussman fracture, where you can see the symphysis fracture and bilateral condylar fracture, and this pattern of fracture is called Gaussman fracture. Okay, here in this coronal view of the CT scan, you can see there is a fracture in the symphysis region, and also both condyles has been fractured. This type of pattern is called Gaussman fracture, and this is called bucket handle fracture, where it can commonly see in old age patients, where resolved bone will be present, right? So because the digastric muscle pull and also thinness of mandible, so, and also if the fracture occurs easily, and this is called bucket handle fracture. And coming to the maxillofacial fractures, here you can see the leaford bone fracture. This is a CT scan. Leaford bone fracture, the fracture line runs from one side of the maxilla to the another side of the maxilla, right? In leaford 2, you can say this kind of a pyramidal fracture. The shape of the fracture line is pyramidal, right? Here you can see in CT scan. And coming to the leaford 3, it is almost, top level fracture, where the fracture line running above the maxilla and also involving orbital bones, nasal bones, zygomatic bones. Okay, it is kind of a complicated when compared to leaford 1 and 2. And this is a submentovertex view of zygomatic arch fracture. Here you can see the zygomatic arch fracture, and submentovertex view is an ideal position for diagnosing these kind of fractures. Okay, and this is a paranasal sinus view where you can see the fractured orbital, the outer canthus of the bone, outer canthus of the eye, and you can see the zygomatic arch fracture here, and outer canthus of the eye fracture, and also fracture occurring on the floor of the orbit. Okay, and coming to the tripod fracture, so you are seeing the fracture line on the lateral canthus, outer canthus of the eye. You can see the fracture line involving the floor of the orbit and also walls of the orbit and also the zygomatic bone. And coming to the next type of fracture, that is orbital floor fracture. And because of the fracture of the orbital floor, the contents of the orbit are getting sucked into the maxillary sinus. Okay, they're getting into the maxillary sinus. And when we take CT scan of this condition, it gives an appearance called teardrop appearance. Okay, and this kind of fracture is called orbital floor fracture, trapdoor fracture, and blowout fracture. Okay, and coming to the investigations commonly used for assessing maxillofacial trauma, IOPA is very least useful. Okay, and OPG is the most common thing which we commonly prescribe. PA scale view based on the need. Okay, and Waters view for best, and it is mainly useful for maxillary sinus and orbital fractures. Submentovertex view for zygomatic arch fractures. Lateral oblique view of the mandible for angular fractures. And when compared to 2D radiographs, 3-dimensional radiographs give more information regarding the fractures. And coming to the next important investigation, that is CT scan. It is gold standard for complex maxillofacial trauma because it provides 3D visualization of bones, right? And we have certain types like multi-detector CT and cone beam CT based on the cone beam. It involves the shape of the beam here is used is cone shaped, but in conventional CT scan it is fan shaped. So they have their own advantages and disadvantages, and we will learn more about it in radiology chapter. And coming to the magnetic resonance imaging, it is not the first line investigation used for fractures, but it is valuable for soft tissue injuries. Suppose in a road accident, the person has suffered the skull fractures. So in order to assess the hematoma of the brain, the MRI gives more information regarding that. Okay. And coming to the ultrasound, it is useful for superficial fractures such as nasal bone and zygomatic arch bone, and it is non-invasive and radiation free and helpful for pediatric patients. So this is a table of list of investigations and what is the best usage. Okay, for dentoalveolar fractures we can use IOP or OPG. Okay, and for screening midface sinus and zygoma fractures we can use Posteroanterior skull views or Waters projections, Submentovertex projections, and CBCT and CT are the gold standard for assessing fractures because they provide 3D images. Okay, and we use MRI for soft tissue contrast and also for nerve injuries. And superficial fractures and in pediatric patients we can use ultrasound, and if there is any vascular trauma detected we can use angiography. Okay, and this is all about list of investigations which we use for maxillofacial trauma, and we'll meet again in the next class. Thank you.